Welcome to a deep dive.
Yeah.
One of the most incredible transformations in human development.
Yeah.
We're going to explore how a baby's lungs and circulatory system get ready for life outside the womb.
Okay.
We'll be using excerpts from medical textbooks and learning materials to guide us. And trust me, you'll be surprised by what you learn.
It's an amazing process and critically important.
So let's unpack this, starting with the lungs.
Okay.
Our sources describe fetal lung development in 5 phases.
Right.
And the timing is just fascinating.
Yeah.
Think about this. Just 26 days after conception,
Wow.
the lungs start as this tiny bud, and by week 7, you can already see the diaphragm forming.
That's the embryonic phase.
It's the embryonic phase.
It's incredible how early these critical structures begin to develop.
It really is.
Yeah.
Then from week 6 to 16, we move into the pseudoglandular phase.
Okay.
It's like watching a tree grow in fast motion as the airways branch out, creating the network we need to breathe.
Setting the stage for the intricate architecture of the lungs.
Then things get really interesting in the canalicular phase, from weeks 17 to 26.
Right?
Capillaries appear, the vascular system starts growing,
Yeah.
and we see the arrival of a magical substance called surfactant.
Oh, yeah.
This is also when a fetus becomes potentially viable outside the womb around 22, 24 weeks because gas exchange can start happening.
Precisely. It's a crucial turning point.
Yeah.
We see the lungs becoming capable of functioning, at least to some degree.
So this brings us to the saccular phase, from weeks 26 to 36.
Okay.
This is when alveoli, those tiny air sacs responsible for gas exchange, begin to form. And get this, more alveoli equals more surface area,
Right.
which means more oxygen.
Makes sense.
It's all about efficiency.
That's right.
And the grand finale is the alveolar phase.
Okay.
And here's the kicker. It continues long after birth, from around 36 weeks to 8 years old.
Wow.
Can you believe that?
That's a long time.
Alveoli are still multiplying like crazy, giving growing lungs the capacity they need.
Wow.
Over 80% of our alveoli actually develop after we're born.
Fascinating, isn't it?
Yeah.
And this long developmental period really underscores the importance of protecting children's respiratory health as they grow.
Okay, so we've got these 5 phases, each building on the last. But what happens if there are hiccups along the way?
Well, any disruption during these delicate phases can potentially lead to problems.
Right.
Our sources mention a condition called pulmonary hypoplasia, which basically means underdeveloped lungs.
Sounds pretty serious.
It can be, depending on the severity.
Yeah.
A number of things can cause it, including a diaphragmatic hernia where the diaphragm doesn't form properly.
Okay.
Another is oligohydramnios, a condition where there's not enough amniotic fluid, which can restrict lung growth.
Okay.
The timing of these issues during development is crucial.
Right.
A problem in the embryonic phase would likely be much more serious than something that pops up later on.
Because those early stages lay the foundation for everything that follows.
Exactly.
It's like building a house. If the foundation's shaky, the full structure is compromised.
Early disruptions can have a cascading effect on later development.
Okay, so these phases are super important, but we can't forget about surfactant.
Right. Yeah.
What's so special about this stuff anyway?
Sure.
You mentioned it earlier, but I'm still a little fuzzy on the details.
So surfactant is truly fascinating.
Right.
Picture this. You have those tiny alveoli, the air sacs in your lungs, right? They're like tiny balloons that inflate and deflate with every breath.
Okay.
But here's the thing. They have this natural tendency to collapse inward due to surface tension. Think about trying to blow up a balloon.
Yeah.
It takes that initial effort to get it started because of the surface tension.
Okay, I'm starting to see where this is going. Surfactant comes in to save the day, right?
Exactly. Surfactant is produced by specialized cells in the alveoli called type 2 pneumocytes.
Okay.
Think of them as tiny surfactant factories.
Okay.
Surfactant reduces that surface tension inside the alveoli, making them easier to inflate. Basically, it acts like a lubricant for those tiny balloons, allowing them to expand and contract smoothly with each breath.
So without enough surfactant, breathing becomes much harder.
Yeah.
And this is a major issue for premature babies.
Right.
Their lungs often haven't had enough time to produce sufficient surfactant.
That makes sense, and that's why preemies often need respiratory support after birth.
Yeah.
I remember hearing about surfactant replacement therapy.
Yeah.
It's amazing what doctors can do these days.
It really is. Surfactant replacement therapy has been a game changer for premature babies,
Yeah.
significantly improving their chances of survival and reducing the risk of long-term lung problems.
It really is.
It's amazing to think that all of this is happening while the baby is still in the womb, surrounded by fluid.
Yeah.
Speaking of which, what about that fluid fetal lung liquid, right?
Right.
Sounds
Oh,
strange.
yeah.
But I know fetuses actually breathe this fluid while they're in the womb.
Mm-hmm.
It's essential for lung development.
That's right. It helps keep those airways open and promotes proper growth. But what happens to all that fluid during labor and birth?
Yeah. What happens to all that?
It's quite a remarkable process.
Okay.
Imagine a three-pronged drainage system.
Go ahead.
During labor, a significant amount of fluid is squeezed out as the baby passes through the birth canal.
Oh, wow.
Then a portion is absorbed into the pulmonary capillaries, those tiny blood vessels surrounding the alveoli.
Okay.
And finally, the lymphatic system removes the remaining fluid.
So it's like a triple threat.
Yeah, it's a remarkably efficient process.
That is so cool. So the lungs are practically primed and ready to go by the time the baby is born?
They are.
But wait a minute. If the baby's lungs aren't functioning for breathing air until birth, how are they getting oxygen in the womb?
That's where the incredible bypass system of fetal circulation comes in.
Okay.
Remember, the fetus gets its oxygen from the placenta, not its own lungs.
Right.
So blood needs to be routed differently.
That's right. And that brings us to those 3 fetal shunts you mentioned earlier. They're like detours on a highway, right?
Precise.
Yeah.
Think of the ductus venusus, the foramen oval, and the ductus arteriosus as specialized routes that direct blood flow away from the lungs and liver, which aren't fully functional yet.
Okay.
They essentially bypass these organs.
Okay. I'm ready to dive into these shunts. Let's start with the ductus venusus. What's its role in this bypass system?
The ductus venusus, it's like a VIP lane for oxygen-rich blood coming from the placenta.
Okay.
It allows that blood to bypass the liver
Mm-hmm.
and flow directly to the heart, ensuring that the most vital organs get priority, you know?
Fascinating.
Yeah,
It's like a fast track for oxygen.
it is.
Okay, what about the foramen oval? That sounds like a fancy name for something important.
It is the foramen oval is an opening between the 2 upper chambers of the heart.
Okay.
Think of it as a temporary doorway
Yeah.
that allows blood to flow directly from the right atrium to the left atrium,
Uh-huh.
bypassing the lungs entirely.
Makes sense given the lungs aren't fully functioning yet. And lastly, what about the ductus arteriosus? Where
Yeah.
does that fit into this intricate bypass system?
So the ductus arteriosus connects the pulmonary artery to the aorta.
Okay.
Normally, the pulmonary artery carries blood to the lungs to pick up oxygen,
Right.
but in a fetus, the ductus arteriosus diverts most of that blood directly to the aorta, again bypassing the lungs.
So it's like a double bypass system,
Yeah.
ensuring that the developing lungs aren't overwhelmed with blood they can't handle yet.
Yeah.
This is all so incredible, but what happens at birth?
Right.
How does this system switch over to normal circulation?
That's where things get really dramatic.
Okay.
Birth triggers a cascade of events that transform fetal circulation into the adult pattern.
Okay.
It's like a carefully choreographed dance.
Okay, I'm on the edge of my seat. Walk me through it.
Okay.
What's the first step in this transformation?
So the first domino to fall is the clamping of the umbilical cord.
Okay.
This cuts off blood flow from the placenta, causing a significant increase in blood pressure in the baby's system.
So it's like suddenly shutting off a major pipeline,
Exactly.
causing a surge in pressure elsewhere.
And this pressure change forces open the pulmonary circulation, meaning the lungs are finally getting the blood flow they need.
So the lungs are finally getting the signal to kick into gear.
Precisely as the lungs inflate with that monumental first breath.
Yeah.
Gas exchange begins, and specialized cells release chemicals that widen the pulmonary blood vessels,
Okay.
further increasing blood flow to the lungs.
So the lungs are getting a double dose of open sesame signals.
Yeah.
What happens to those bypasses, the foramen oval and the ductus arteriosus?
So with all this blood now flowing to the lungs, the pressure in the heart starts to shift.
Okay.
The foramen oval, that opening between the atria, closes
Uh-huh.
because the pressure in the left atrium becomes higher than the pressure in the right atrium.
So now blood is flowing in the normal way from the right atrium to the right ventricle,
Right.
then to the lungs, back to the left atrium, and finally to the left ventricle and out to the body. It's like a symphony of physiological changes.
You got it. And as for the ductus arteriosus, it starts to close as well. In response to the increased oxygen levels in the baby's blood
Yeah.
and the decrease in pulmonary vascular resistance,
Okay.
the body is essentially saying, we don't need this detour anymore. The lungs are open for business.
This whole process is just mind-blowing. It's like a perfectly synchronized ballet of pressure changes, chemical signals, and anatomical shifts all happening within minutes of birth. And to think we all went through this incredible transformation.
It really highlights the marvel of human development.
Yeah.
But what's even more fascinating is that these shunts don't always close perfectly.
Oh,
Sometimes they can remain open after birth, leading to a condition called patent ductus arteriosus, or PDA.
what happens when the ductus arteriosus stays open? Is that a serious problem?
It depends on the size of the opening.
Okay.
A small PDA may not cause any noticeable symptoms and might even close on its own over time, but a larger PDA can allow too much blood to flow to the lungs, putting a strain on the heart and leading to breathing difficulties.
Oh, wow.
It's as if the bypass system is still running even though the lungs are now fully functional.
That makes sense. So it can create an imbalance in the circulatory system.
Yeah.
But luckily you mentioned it's treatable, right?
Yes, fortunately, PDA is often treatable with medications or, in some cases, surgery.
Okay.
It's a condition that medical professionals are well equipped to handle.
That's reassuring to know.
Yeah.
Okay, so we've talked about this incredible transition from fetal to newborn circulation.
Right.
But let's shift gears a bit and explore something I find truly fascinating, the impact of the intrauterine environment, or the conditions inside the womb,
Okay.
on fetal lung development.
This is an area of research that has really exploded in recent years.
Yeah.
It turns out that factors like the mother's health, her diet, and exposure to certain substances can have a significant impact on how a baby's lungs develop, even influencing their respiratory health throughout their life.
It's like the womb is a microcosm,
It is.
shaping the baby's future health. It makes you realize how interconnected everything is.
Absolutely. It highlights the profound influence of the prenatal environment.
Right.
One area of focus is maternal nutrition. For example, research shows that a diet rich in antioxidants during pregnancy can promote healthy lung development in the fetus.
Okay.
Antioxidants protect cells from damage,
Uh-huh.
so it stands to reason that they would benefit those tiny developing lungs as well.
That makes perfect sense.
Yeah.
It's like giving those developing lungs an extra layer of protection. Are there things that pregnant women should avoid to protect their baby's lungs?
Definitely things like smoking during pregnancy have been linked to a host of respiratory problems in children.
Right.
We're talking about increased risk of asthma, chronic obstructive pulmonary disease, COPD, and even a higher susceptibility to respiratory infections.
Wow.
Yeah.
It's a stark reminder of the importance of making healthy choices during pregnancy. It's not just about the mother's health, it's about setting the stage for the baby's well-being too. But what about things that are harder to control, like exposure to air pollution?
Unfortunately, exposure to environmental toxins like air pollution can also negatively impact fetal lung development.
Right.
It's a complex issue, but it underscores the need for cleaner air and a healthier environment for everyone, especially pregnant women and their developing babies.
It's a sobering reminder of how interconnected we are with our environment.
It is.
It makes you appreciate the importance of advocating for policies that protect our air and water quality.
Yeah.
But honestly, hearing about all these potential risks can feel a bit overwhelming.
Yeah.
What can expectant mothers do to protect their babies?
It's important not to panic.
Okay.
While there are many factors that can influence fetal lung development, there are also many things expectant mothers can do to promote healthy lung growth in their babies.
Okay, give me the good news. What are some practical steps?
Maintaining a healthy lifestyle during pregnancy is key.
Okay.
This includes eating a nutritious diet packed with fruits, vegetables, and lean proteins.
Yeah?
Regular exercise is beneficial as well.
Okay.
And of course, avoiding smoking and exposure to other harmful substances is paramount.
That sounds like good advice for everyone pregnant or not.
Absolutely. But it's especially important during those crucial 9 months when those tiny lungs are forming and growing.
What about prenatal care? Does that play a role in lung development?
Absolutely. Regular prenatal checkups are crucial for monitoring the health of both the mother and the developing baby.
Okay.
Early detection of any potential problems like gestational diabetes or preeclampsia can help prevent complications that could impact lung development.
So prenatal care is like preventative maintenance for the baby's lungs,
I like that analogy. It's
That's
an
what-
excellent way to think about it.
ensuring everything is developing as it should.
And in some cases, if a baby is born prematurely, doctors can administer surfactant replacement therapy to help those tiny lungs function properly.
That's incredible. So even if a baby's lungs haven't fully matured, there are interventions that can help. It's amazing how medical science is continually advancing.
It really is a testament to how much we've learned about fetal lung development.
Yeah.
Now we can use that knowledge to improve outcomes for babies born prematurely.
It gives hope to families facing those challenging situations.
Definitely. It's a powerful reminder of the progress we've made in neonatal care. But remember, fetal development isn't just about the environment.
Right.
Genetics also plays a significant role.
That's right. We can't forget about the genetic blueprint that the baby inherits.
Exactly. There are a number of genetic disorders that can interfere with normal lung development.
Right.
Cystic fibrosis is one example.
Okay.
It causes thick, sticky mucus to build up in the lungs, making it difficult to breathe.
Huh.
Another is congenital diaphragmatic hernia, which we discussed earlier. It's a condition where there's a hole in the diaphragm,
Right.
which can crowd the lungs and hinder their development.
So in these cases, it's not just about environmental factors,
Right.
but also the genes the baby inherits.
Exactly.
It really underscores the complexity of fetal development, how it's a delicate dance between genetics and environment.
Precisely. And any disruption to that delicate dance can have consequences for the baby's health.
It really makes you appreciate how incredible it is that most babies are born healthy, considering all the factors that can influence their development.
It is.
But speaking of incredible, didn't you mention something surprising about the fetal lungs? Something about them being active in the womb? I have to admit, that really piqued my curiosity.
Yes. It might surprise you to learn that fetal lungs aren't just passively waiting to be activated at birth. They're actually quite active in the womb,
What?
making breathing-like movements even though they're filled with fluid.
Wait, what? I thought the fetus gets its oxygen from the placenta, not its own lungs.
Right?
So why would the lungs be doing that if they're not actually taking in air?
That's a great question. It's something that has puzzled scientists for years.
Yeah.
But recent research suggests that these fetal breathing movements might play a vital role in lung development itself.
So they're not breathing air, but these movements are still important. How so?
Well, it seems that these movements help stretch and strengthen the lung muscles, essentially preparing them for the real deal after birth. It's like a workout for the lungs.
That's an amazing image.
Yeah.
I love the idea of those tiny lungs getting a head start.
Yeah.
Are there any other benefits to these movements?
Yes, these breathing movements also help stimulate the production of surfactant,
Right.
which, as we discussed earlier, is crucial for keeping the alveoli from collapsing.
So it's like a 2-for-1 deal.
It is.
Strengthening the muscles and boosting surfactant production. The lungs are getting a head start on everything.
Exactly.
Mm.
It highlights how interconnected and efficient these developmental processes are.
Yeah.
It's not just one thing happening after another.
Right.
It's about all these systems working together in perfect harmony to prepare that little one for life outside the womb.
It's truly remarkable. But, we've been focusing so much on the lungs.
Yeah.
What about the other senses? How do those develop in the womb? When does a fetus start to hear sounds, for instance? Can they even see light in there?
That's a great segue. We've explored the amazing world of fetal lung development.
Right.
And now we're ready to dive into the equally fascinating realm of the senses.
Okay.
Buckle up. It's going to be an incredible journey.
It's amazing to think about how all the senses develop.
Yeah.
Even before a baby is born.
Yeah.
It's like they're getting ready to experience the world from the very beginning.
It really is remarkable. And the sense of hearing is one of the first to develop.
Okay.
A fetus can actually start perceiving sounds as early as 18 weeks gestation.
Wow, that's much earlier than I would have guessed.
Yeah.
But what exactly can they hear at that stage?
Well, imagine a world of constant rhythmic sounds, the mother's heartbeat, the whooshing of blood flow, the gentle gurgling of her digestive system. It's like a soothing symphony that surrounds them.
It's like their first introduction to the world is through the sounds of their mother's body.
Exactly. And then as the auditory system matures, the fetus becomes more attuned to sounds from the outside world, especially their mother's voice.
That makes sense. The mother's voice is probably the most consistent sound they hear.
Yes, and around 25 weeks gestation, they can even distinguish between different voices and languages.
That's incredible. So even before birth, babies are developing a preference for their mother's voice and the language they'll eventually speak.
Yeah.
It's like they're already starting to learn.
It really is a testament to that powerful bond between a mother and her baby.
Yeah.
And studies have shown that babies can remember sounds they heard in the womb even after they're born.
This makes me think about all those times I sang to my baby bump when I was pregnant. I thought I was just soothing myself, but maybe my baby was listening and learning too.
It's very likely those lullabies and gentle words can actually have a calming effect on the baby both before and after birth.
Right.
This early exposure to language is thought to be a foundation for language development later on.
It makes you wonder if playing classical music or reading aloud to a baby in the womb could give them a head start on learning.
That's a great question, and while there's no definitive proof that it makes them smarter, It certainly can't hurt to create a rich and stimulating auditory environment for them.
I love that idea. It's never too early to start sharing the love of music and stories.
Hmm.
Okay, so hearing is pretty well developed before birth, but what about sight? Can babies actually see anything in the womb?
Yeah.
It's hard to imagine considering they're surrounded by darkness.
It's not as straightforward as hearing.
Yeah.
While the eyes themselves start developing early on, around 6 weeks gestation, true vision doesn't emerge until much later.
Why is that? Is it because it's so dark in there?
That's a big part of it. Light doesn't penetrate very far into the womb.
Right.
So even though the eyes are forming, there's not much visual stimulation.
Yeah.
It's a bit like being in a dark room.
I see. So when do the eyes actually start to perceive light?
Around 26 weeks gestation, the fetus's eyes begin to open
Okay.
and become sensitive to light. If you shine a bright light on a pregnant belly at this stage, the baby might even turn their head away from it.
Oh, wow. It's like they're saying, hey, that's too bright. So they can sense light and darkness. But they can't actually see images yet.
Exactly. True vision, the ability to focus on objects and perceive details, develops after birth.
Okay.
Newborns are actually quite nearsighted.
Right.
They can only see things clearly that are about 8–12 inches away.
Now that you mention it, that makes perfect sense.
Yeah.
That's about the distance to their mother's face when they're breastfeeding.
Exactly.
It's like their vision is perfectly adapted to those early bonding moments.
And as they grow and interact with the world, their vision gradually sharpens, and their brain learns to process all those complex visual signals.
It's mind-blowing to think about all this sensory development that's happening in the womb, preparing babies for the outside world.
It truly is a testament to the intricate and awe-inspiring process of human development,
Yeah.
and we've only scratched the surface of what we know about it.
You know, this whole deep dive has been incredible. It's made me realize that fetal development isn't just about babies growing bigger.
Right.
It's about them developing all those intricate systems and senses that allow us to experience the world.
I couldn't agree more. The more we understand these processes, the better equipped we are to ensure healthy pregnancies and give every baby the best possible start in life.
It's been such a fascinating journey learning about how those tiny lungs get ready for that first breath and how their senses begin to awaken. But we focused a lot on hearing and sight. What about the other senses? When do smell and taste come online? And what role do they play in this incredible story of fetal development? That's something for you to ponder as we wrap up our deep dive. Thanks for joining us.